People, namaste, welcome back to my channel. This is the video of continuation of asphyxiant gases. In previous video I discussed about the carbon monoxide gas. Another important question for university exams is cyanide gas, like HCN. What is it? Hydrocyanic acid. It is all they will ask in bits like other names like prussic acid, other names called prussic acid. Next, cyanogen. Another one is called Shields acid. They will ask discuss about the prussic acid or discuss about the Shields acid, something in bits also they will tell. It is also called as hydrocyanic acid, HCN acid. Next, they are in the form of three forms, like solid form or solid, we can not call it solid, gas, liquid, and salt form. Salt means solid form. This gas form is called hydrogen cyanide, hydrogen cyanide gas. Liquid form means same, hydrocyanic acid. Next, salt means sodium or potassium cyanide. These are the three forms. Next, what are the sources? Sources are natural, chemical, and heterogenic. Natural sources, chemical sources, and heterogenic sources. What are the natural sources of hydrogen cyanide? Natural means these are present in bitter almond. See, these are the important one. Bitter almond, they're present in bitter almond, apricot, cherry also, and other fruit tips. Other fruit other food pits. Next, chemical means the first of all cyanide is present in the jewelry, metallurgy of jewelry, and rodicide and insecticide sprays are present. No, all these are insecticides, rodicides, and metallurgy, like in jewelry you can use cyanide. And silver and metal polishing solutions also, silver and metal polishing solutions also. In all these fumigating products and photographic development solution also, all these chemical cyanides are present. Next, hydrogenic is sodium nitroprusside, sodium nitroprusside, and sodium nitroprusside cyanide is present. So these are the sources. So in cyanide having specific smell is bitter almond. Bitter almond, specific smell is bitter almond. Generally this bitter almond is 20 to 40% cannot pursue because they are X-linked recessive sometimes. Okay, cyanide is a specific smell called bitter almond. Next, come to the routes of absorption, like absorption, like they have a inhalation route, oral route, and skin route. All these are route. Next, mechanism of action. What is the mechanism of action? Cyanide has high affinity for Fe plus 3. High affinity plus Fe plus 3 present in chromite. Cytochrome oxidase. Cytochrome oxidase along with methyl hemoglobin also. All these are Fe plus 3. So cyanide reacts with cytochrome oxidase and inhibits cytochrome. Cyanide inhibit the cytochrome oxidase. While inhibiting the cytochrome oxidase, it inhibits the etc transport. etc transport is inhibited. After inhibited, because of the cell unable to transport oxygen to the unable to utilize, not transport, utilize oxygen. They having oxygen but can't utilize because of absence of cytochrome oxidase. It is called histotoxic or cytotoxic anemia. Histotoxic or cytotoxic enemy. In previous video of carbon monoxide, I discussed it is an anemic anoxia. They does not have oxygen because in previous video of carbon monoxide, oxygen cannot go into the cell. Loading and unloading will be decreased, so cannot go into the cell. A cell cannot have oxygen, so it is called anemic oxygen. Here oxygen is present but utilization of oxygen is inhibited because of cytochrome oxidase is inhibited, etc transport inhibited, so cell can't utilize the oxygen, so it is called histotoxic or cytotoxic and anoxia. Next, clinical features are mild. Clinical features are like headache. All these are come, see, headache, vertigo, like weakness, restlessness, palpitations because of cyanide, restlessness, palpitations. Next, confusion, decreased vision. You can write some of this: bradycardia, heart rate decreases. Next, same confusion, convulsions, loss of consciousness. All these: confusion, convulsions, loss of consciousness, and loss of corneal reflexes. Corneal reflex. You can write. You can remember like forces: confusion, convulsions, loss of corneal reflexes, and decreased vision. Like bradycardia, heart rate, all these are death will also occur. These are some of the clinical phases of cyanide. So fatal dose. What is the fatal dose? Fatal dose of hydrogen cyanide, HCN, and sodium and potassium cyanide also. Sodium and potassium. This is 250 mg, only 50 mg. This is 200 mg. 250 mg, 250 mg, 200 mg. Next, treatment. Treatment, first stop exposure. Stop the exposure and wash with water, all this, remove clothing. All you can write. After that, we should write the antidote of cyanide. Antidote is Lilly's antidote. Lilly's antidote. Lilly's antidote have three are present in Lilly's antidote. First, amyl nitrate, sodium nitrate, amyl nitrate, sodium nitrate, amyl nitrate, sodium thiosulfate. Sodium nitrate, amyl nitrate, and sodium thiosulfate. First, mechanism of action. What is mechanism of action? Is sodium nitrate, amyl nitrate, when it enters into our body, it reacts with hemoglobin. See, sodium or amyl nitrate are present. No, this antecedent, when we take this antidote, it binds with the hemoglobin, consists of Fe+3. Hemoglobin is Fe+3. No, it binds with hemoglobin. After hemoglobin, it converts it into methyl. It binds with methyl hemoglobin. Okay, Fe+3, methyl hemoglobin. Methyl hemoglobin converts into methyl hemoglobin cyanide, called as methyl hemoglobin. Wait a minute. See, when nitrates combines with the methyl hemoglobin, converts into methmoglobin. Okay. When we give a nitrates, it binds with methyl hemoglobin, converts into methmoglobin. If the cyanide is present in the body, then it combines with methmoglobin combines with cyanide to form cyanometmoglobin. This cyanometmoglobin is generally, if cyanometmoglobin also excreted in urine, but cyanometmoglobin is their sodium thiosulfate. So because of antidote of sodium thiosulfate, converted into thiocyanate. Sodium thiocyanate. Sulfate is converted into sodium thiocyanate. It is also excreted in urine. It is a non-toxic form. Okay. See, this is the Lilly's antidote. Very, very important. Lilly's antidote consists of amyl nitrate, sodium nitrate, and sodium thiosulfate. When this amyl or sodium nitrate added with our methyl hemoglobin, added with methyl hemoglobin, this methyl hemoglobin converted into methmoglobin. When there is in the body, we contains of cyanide, this methmoglobin added with the cyanide to form a cyanometmoglobin. Cyanometmoglobin generally excreted when we have an antidote like sodium thiosulfate. It converted into sodium thiocyanate. This is excreted into the urine. This is the antidote of cyanide. Another antidote is also present. Fourth point, hydrocobalamin. What will do hydrocobalamin? This hydrocobalamin, when we given hydrocobalamin in our body, cyanide is present. So cyanide, by adding cyanide with the hydrocobalamin, they convert into cyanocobalamin. This cyanocobalamin excreted in urine. So hydrocobalamin reacts with HCN to form cyanocobalamin excreted in urine. Next another antidote is EDTA. Cobalt EDTA. hydrocobalamin and cobalt EDTA. These are the some of the antidotes. Most important is Lilly's antidote, cobalamin also, hydrocobalamin. Next, EDTA also one of the antidote used in cyanide poisoning. Okay, next we will discuss about the appearance, postmortem appearance. See, because of cyanide, bright red hypostasis is present. Color, bright red hypostasis. And I discussed like smell, bitter almond smell is present. Same as carbon monoxide, it has bilateral necrosis of lenticular nodes. Next, rigor mortis here because of cyanide. Rigor mortis starts early, persists late. Starts early and persists late. So these are the postmortem appearance. Next, what is the test? Test for cyanide poisoning is John Lee Jones test. Jones test. Lee Jones test. Medical legal importance of cyanide test. Generally suicide. Used as a suicide like pills. Pills. Next, homicides. Homicides also they are used. Generally they are used in World War II. World War II by Nazis. Next, in judicial execution, carbon monoxide poisoning used for criminals. Okay, this is the medical legal importance. So I will discuss this in a summary. Please concentrate, please. Hydrocyanide. Hydrocyanide is also called prussic acid, Scheele's acid, and cyanogen. Okay, cyanide has three forms. What is the three forms? Gas, liquid, and salt form. Gas is hydrogen cyanide, hydrocyanic acid, sodium and potassium cyanide. Source are natural, chemical, heterogenic. Natural are bitter almond. Next, cherry, apricot, other fruit tips, and chemicals are rodents, insecticides, metallurgy like photographic development solution in silver and metal, polishing solution, fumigating products also. Heterogenic is sodium nitrate. Next, specific smell is bitter almond. 20 to 40% can't perceive the smell because of X-linked recessive trait. Route of absorption is inhalation, oral, and skin. Okay, generally most absorbed gas, then acid, then salt. Achlorhydric persons will not suffer these cyanide symptoms. Next, we will discuss about the action, mechanism of action. This cyanide has high affinity with Fe+3. So Fe+3 is more present in cytochrome oxidase and methemoglobin. So it inhibits the cytochrome oxidase. Cytochrome oxidase inhibition leads to ETC transport inhibition. So cell unable to utilize the oxygen, it is called histotoxic or cytotoxic anoxia. Because of this hypoxic injury, brain and heart mainly injured. Clinical features: smile like headache, vertigo, restlessness, palpitations, confusions, convulsions, decreased vision, loss of consciousness, and loss of corneal reflexes. Lastly, depth, cardiac and respiratory arrest. Next, fatal dose. Fatal dose of HCN is 50 mg. Next, sodium and potassium is 200 mg. Treatment: stop exposure, remove clothing. Lilly's antidote. Lilly's antidote consists of amyl nitrate, sodium nitrate, and sodium thiosulfate. See, when the sodium or amyl nitrate combined with our methemoglobin, convert into methemoglobin. Methemoglobin added with cyanide converted into cyanomethemoglobin. This cyanomethemoglobin in urine excreted. It can excrete urine, but if we have sodium thiosulfate, it converted into thiocyanide. Thiocyanide is an non-toxic gas. It can excrete it into urine. See, sodium thiocyanate. Sodium thiocyanate is present. No. Sodium thiosulfate converted into thiocyanate in presence of Rhodase. Because of Rhodase enzyme, it converted into thiocyanate. Okay, next antidote is hydrocobalamin. This hydrocobalamin reacts with the cyanide to form cyanocobalamin. Next, last one is cobalt EDTA. See, another one is present. This Lilly's antidote is there no, that have ampule. In presence of ampule, it contains break the ampule, contains 0.2 ml of amyl nitrate in a cloth. Take a cloth and break the ampule and it consists of amyl nitrate in a cloth and kept near the nose for 15 to 30 seconds. 0.2 ml amyl nitrate in a cloth and kept it for nose for 50 to 30 seconds. Okay, repeat every minute until sodium nitrate infusion starts. until the nitrate infusion starts, up to which you should kept in to the mouth for 15 to 30 seconds. Next, up to 3% of after 0.2 ml of amyl nitrate. Next, here comes sodium nitrate. 3% of sodium nitrate is given slowly IV over 5 to 10 minutes. Amyl nitrate is over. Next to sodium nitrate. Sodium nitrate how much percent? 3% over 5, same 5 to 10 minutes. If here seconds, take in a cloth and seconds. Here IV infusion, like IV infusion over 15 to 30, 5 to 10 minutes. Next, after that, 25% of sodium thiosulfate slowly over IV. This is also 25%. Here 0.2 ml. Here 3% of sodium nitrate. Here 25% of sodium thiosulfate. Here also IV. Here also IV. Here at the take the cloth and put at the nose for 15 to 30 seconds. Here 5 to 10 minutes. Here also not that one, slowly IV. If symptoms persist, half dose is repeated. Okay, this is the Lilly's antidote. How we can give the Lilly's antidote. Okay, 0.2 ml of sodium nitrate. First one, amyl nitrate. Next to 25% of 3% of sodium nitrate and 25% of thiosulfate. Next, postmortem appearance I discuss, like a bright red, bitter almond, same bilateral symmetrical necrosis of lenticular nodes of basal ganglia, and rigor mortis starts early and persists longer. Cyanide poisoning is Leigh-Jones test. Medical legal importance, what is suicidal? Suicidal pills in rings and hollow teeth, and homicide, which generally used by Nazis in World War II. They are used cyanide, and judicial execution, cyanide poisoning for execution of criminals. So this is the video of cyanide. Thank you. Please subscribe my channel and please support us. Thank you.